For what purpose does the gentleman from Texas seek recognition?
Mr. Speaker, I move that the House suspend the rules and pass the bill H.R. 3838 as amended.
The clerk will report the title of the bill.
Union Calendar Number 196, H.R. 3838, a bill to amend Title III of the Public Health Service Act to reauthorize federal support of states in their work to save and sustain the health of mothers during pregnancy, childbirth, and the postpartum period to eliminate disparities in maternal health outcomes for pregnancy-related and pregnancy-associated deaths, to identify solutions to improve health care quality and health outcomes for mothers, and for other purposes.
Pursuant to the rule, the gentleman from Texas, Mr. Burgess, and the gentlewoman from Washington, Ms. Schreier, each will control 20 minutes. The chair recognizes the gentleman from Texas.
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials into the record on the bill.
Without objection.
Mr. Speaker, I then yield myself so much time as I may consume.
The gentleman is recognized.
I rise today in support of my legislation, H.R. 3838, the Preventing Maternal Deaths Reauthorization Act of 2023. During March, we celebrate National Women's History Month. We honor the strong women in our lives, and especially our mothers, who make great sacrifices to bring life into this world. According to the latest United States data, the maternal mortality rate rose yet again in 2021 to almost 33 deaths per 100,000 live births, compared to a rate of 23 per 100,000 in 2020. While we know that over 80% of pregnancy-related deaths are preventable, we also understand that even one is too many. Preventing Maternal Deaths Reauthorization Act works to understand and reduce maternal mortalities by reauthorizing federal support for state-led maternal mortality review committees. Maternal mortality review committees are multidisciplinary committees that review the causes of maternal deaths in their state and make recommendations based on their findings to prevent future deaths and improve maternal health outcomes during pregnancy, childbirth, and the first year afterward. H.R. 3838 also requires the Center for Disease Control and Prevention to work in consultation with the Health Resources and Services Administration to disseminate best practices for the prevention of maternal mortality and morbidity to hospitals and other healthcare providers. Maternal mortality review committees are vital to understanding the drivers of maternal deaths and informing effective interventions. This way, we'll help to ensure that resources are directed where they will have the most positive impact. Since its initial authorization in 2018, we have already seen the work of the maternal mortality review committees make a significant difference in increasing the number of maternal mortality review committees from 32 states to 49 states, the District of Columbia, New York City, Philadelphia, and Puerto Rico. Through their work, this body was able to discover that over 50% of pregnancy-related deaths happened between 1 week and 1 year after delivery, leading to the critical extension of the state plan amendment for Medicaid and Children's Health Insurance Program to 12 months for postpartum coverage. The critical importance of this bill is furthered by the news from my home state of Texas just last week. Effective March 1st of 2024, Texas extended postpartum coverage for the full 12 months for eligible Medicaid and Children's Health Insurance Program recipients through Texas. The Texas Health and Human Services Commission will administer this, and I certainly want to thank Governor Greg Abbott and the Texas legislature for their continued efforts to protect and defend life, especially the lives of new mothers and newborn babies. Today, I am joined by 740 of my fellow OB-GYNs who are on the Hill with the American College of Obstetricians and Gynecologists urging a yes vote on this critically important bill. I want to thank my fellow representatives Diana DeGette, Buddy Carter, Robin Kelly, and Kat Kamek, and Kathy Castor for working with me on this important legislation. Mr. Speaker, I stand in strong support of H.R. 3838 and urge fellow members to vote for its passage today, and I will reserve the balance of my time.
Gentleman reserves. The gentlewoman is recognized.
Thank you, Mr. Speaker. I'd like to yield as much time as she may consume to my colleague, Representative Diana DeGette from the state of Colorado.
Gentleman's recognized.
I thank the gentlelady for yielding. As Dr. Burgess said, we're facing a maternal health crisis in this country. From 2018 to 2021, the overall maternal mortality rate in the United States nearly doubled. We're simply failing American women as they become mothers. And we're particularly failing Black Americans, who in 2021 were nearly 3 times as likely than white Americans to die becoming mothers, irrespective of education or socioeconomic status. This is exactly the trend that the former gentlelady from Washington, Ms. Herrera Butler, and I sought to address when we passed the original Preventing Maternal Deaths Act in 2018. Through the programs developed by that legislation, we now have a much greater knowledge of what's causing this crisis and the infrastructure we need to build further understanding and drive solutions. Data generated by the maternal mortality review committees have provided us with the insight that 80% of maternal deaths are preventable. This understanding is the first step towards solutions, and we have to ensure that not only we don't lose, but that we strengthen the process we have made in building understanding and standardizing data so that we have a clear picture across the country of why this is happening. The Preventing Maternal Deaths Reauthorization Act will continue and bolster our support for the maternal mortality review committees. It will also ensure the timely and frequent dissemination of best practices to prevent maternal mortality. Make no mistake, further action is needed, and this reauthorization in itself will not solve the crisis. But that further action depends on the critical insights that we can get from this legislation. It's the foundation on which the solutions stand. I'm very grateful that my friend Dr. Burgess has taken up the mantle on this legislation, also my dear friend Kathy Castor and our ranking member here, and I urge a yes vote on the legislation and yield back.
Does the gentlewoman reserve?
I reserve.
The gentleman from Texas is recognized.
Thank you, Mr. Speaker. At this time, I'm pleased to recognize the gentleman from Georgia, Mr. Carter, for 3 minutes.
The gentleman is recognized.
I thank the gentleman for yielding. And before I begin, Mr. Speaker, I want to thank my colleague, the sponsor of this bill, Dr. Burgess, for his outstanding work in health care, especially as a member of this august body. For many years, he served here, and I know he's going to be retiring at the end of this year, and we're certainly going to miss his leadership, particularly in the healthcare space, and we appreciate you very much. Mr. Chairman, I rise today in strong support of H.R. 3838, the Preventing Maternal Deaths Reauthorization Act, which I am co-leading with Dr. Burgess. Maternal mortality is something that I've worked on for many, many years as a member of the Georgia State Legislature and now as a member of Congress. It baffles me as to why Georgia, my home state, would be one of the leading states in the nation in maternal mortality. Have not been able to get my arms around that and understand why that is, but it is. Our nation's maternal mortality crisis, which, as I say, severely impacts Georgians, is alarming and trending in the wrong direction. In fact, in Georgia, the maternal mortality rate has increased to over 30 deaths per 100,000 live births. For women of color and people living in rural communities, those numbers are much higher. The United States is trending in the wrong direction as well, and we need to understand why moms are dying, despite us spending $4.4 trillion on health care in 2022. As a father, as a grandfather, and a healthcare professional, I believe that we can and we must do much better. It's time for this to become a national priority, which is why I am proud to be co-leading the Preventing Maternal Deaths Act with Dr. Burgess. This legislation will ensure continued support for the critically important work that the state maternal mortality review committees have done in addressing the maternal mortality crisis. State maternal mortality review committees are crucial to collecting data so that each state can form a plan to address maternal health issues impacting their community. This bipartisan bill is an important step towards ending the maternal mortality crisis in the U.S. We value women, we value life, and this bipartisan bill prioritizes both. I'd like to thank again Dr. Burgess for working with me on this important issue, and I urge my colleagues to support this legislation. Thank you, Mr. Chairman, and I yield back.
Gentleman reserves. The gentlewoman is recognized.
Mr. Speaker, I yield myself as much time as I may consume.
The gentlewoman is recognized.
Mr. Speaker, the United States faces a significant crisis with one of the highest maternal mortality and morbidity rates among developed nations. According to the most recent data, in 2021, more than 1,200 women died as a result of pregnancy or childbirth, continuing an upward trend over nearly 20 years. Racial disparities in maternal outcomes continue, with Black and Indigenous women dying at 3 times the rate of white women. Additionally, rural areas experience higher rates of maternal mortality compared to urban areas. And yet, experts and research using the Maternal Mortality Review Committee data indicates that at least 80% of maternal mortalities are preventable. H.R. 3838, the Preventing Maternal Deaths Reauthorization Act of 2023, is bipartisan legislation to reauthorize support for state-based maternal mortality review committees until 2028. These committees play a critical role in reviewing pregnancy-related deaths to identify causes and make recommendations for the prevention of future mortalities in their state. The legislation also requires the Centers for Disease Control and Prevention, the CDC, to work with HHS, the Health Resources and Services Administration, HRSA, to share the best practices to prevent maternal mortality with hospitals and healthcare providers. Enacting this legislation will provide the needed ongoing support of maternal mortality review committees, ultimately enhancing the safety of women throughout their pregnancy, delivery, and postpartum experiences while reducing racial disparities in outcomes. The legislation is supported by over 85 organizations across the healthcare spectrum. I'm pleased that it is before us today, and I encourage all of my colleagues to vote yes on this important bill. I reserve the balance of my time.
The gentlewoman reserves. The gentleman from Texas is recognized.
Thank you, Mr. Speaker. I'll yield myself 1 minute.
The gentleman is recognized.
I do want to point out in this bill, probably one of the most important aspects is the collection and dissemination of data by the CDC and HRSA, the best practices that occur across the country. There's no reason why one hospital should have excellent statistics and another hospital has questionable statistics. We should be able to be good enough that every hospital has excellent statistics. I know this to be true because where I did my residency at Parkland Hospital in Dallas, they have consistently had some of the best maternal mortality statistics in the country, and they take care of a population that is low income, women of color, underinsured, uninsured, the very populations that you would think would be at greatest risk. So I know we can do it. I've seen it done, and it's so important to me that we collect and disseminate this data. I'll reserve my time.
The gentleman reserves. The gentlewoman is recognized.
I yield as much time as she may need to my colleague, Representative Kathy Castor from Florida.
The gentlewoman is recognized.
Well, I thank Dr. Schreier for yielding the time. I rise in strong support of the Preventing Maternal Deaths Reauthorization Act. It's critical legislation that I am proud to co-lead to address the maternal mortality crisis in America, unconscionably the worst in the developed world. You know, each of us deserves to live a healthy life, and for mothers, for women, that includes access to the care they need before, during, and after pregnancy. But pregnancy in America right now is too often traumatic, or it's life-threatening, and our maternal health crisis in many places is tearing families apart. This is particularly true for Black women, who often experience worst outcomes due to disparities in access to medical care, the care that they need and that they deserve. Our bill will help recommit to the health of our neighbors by ensuring that more moms can have safe pregnancies and by improving health outcomes for the patients at the highest risk of maternal mortality and morbidity. In the Tampa Bay area, I'm proud to represent outstanding OBGYNs and providers like clinics like Avera Health or organizations like Reach Up and the Healthy Start Coalitions and more. They have worked tirelessly to address our maternal mortality rates and improve the quality care for new and expecting mothers. This bill will help them. And similar organizations across the country in partnership with CDC by building upon the comprehensive framework of the Preventing Maternal Deaths Act supporting maternal mortality review committees, and strengthening life-saving initiatives to improve health outcomes. For example, Florida's Maternal Mortality Review Committee has successfully created initiatives to reduce deaths associated with postpartum bleeding and opioid use disorder. But we have to do more, and I look forward to working with my colleagues to address America's maternal mortality crisis through research, through prevention, and evidence-based practices. And I want to thank my partners on the Energy and Commerce Committee who brought this bill to the floor, Congressman Burgess, Congresswoman DeGette, Congressman Carter, Congresswoman Kelly for her years of advocacy, Dr. Schreier, Ms. Kamek as well. Thank you for co-leading this legislation with me. Families are counting on us. Please vote yes, and I yield back the balance of my time.
I reserve.
The gentlewoman reserves. The gentleman from Texas is recognized.
I'll reserve, Mr. Speaker.
The gentleman reserves. The gentlewoman is recognized.
I'd like to yield as much time as she may require to Representative Robin Kelly.
The gentlewoman is recognized.
Mr. Speaker, I rise today in support of this bipartisan effort to address the maternal health crisis. One of the most glaring inequities in our country is the disparities in maternal health outcomes. In the richest country in the world, the United States is falling behind and failing our mothers and babies. Over 1,000 women died in 2021 because of complications from childbirth. This is up from 861 deaths in 2020 and 754 deaths in 2019. What's even worse, as you've heard, is that Black women are nearly 3 times more likely to die from pregnancy-related causes as non-Hispanic white women, and that depends on where you live. Where I represent is 6 times as likely. Indigenous women are more than twice as likely to die from pregnancy-related causes as non-Hispanic white women. Again, it depends on where they live, but this is just unacceptable. But I'm proud to say that this legislation will bring us closer to a future where no mother has to worry that growing her family will cost her life. The Preventing Maternal Deaths Act that I co-led with Reps. Burgess, Kamek, Castor, Carter, and DeGette will strengthen and expand federal support for maternal mortality review committees, or MMRCs. State-fashioned MMRCs are tasked with identifying maternal deaths, analyzing the factors that contributed to those deaths, and translating those lessons into policy changes. I am proud to say that a piece of my comprehensive maternal health legislation, the Mamas Act, is included in this legislation. The Preventing Maternal Death Act has received unanimous bipartisan support from the Energy and Commerce Health Subcommittee and the full committee. I encourage my colleagues to support this bill and save moms' lives. Thank you, and I yield back.
Mr. Speaker, I have no more speakers, and I reserve.
The gentlewoman reserves. The gentleman from Texas is recognized.
I'm prepared to close when the gentlelady's
The
finished.
gentleman is prepared to close. The gentleman reserves. The gentlewoman is recognized.
I'm prepared to close. I am so pleased that this bill is before us today. I encourage all of my colleagues to vote yes on this very important bill that will save lives. I yield back.
The gentlewoman yields. The gentleman from Texas is recognized.
Thank you, Mr. Speaker. I'll yield myself the balance of our time. Mr. Speaker, this bill is personally important to me. My grandfather, who I never knew, my father's father, was an academic obstetrician in McGill Hospital in Montreal from the end of the First World War until his death in 1939. During that time, maternal mortality was substantially reduced. The caregivers of that time, prior to the introduction of antibiotics, made great strides in reducing maternal mortality. Some of that was through the imposition of preventive medicine. Some of that was because of improved anesthesia and blood bank techniques. And of course, with the introduction of antibiotics in 1940, the rates came down even substantially more. So we know it can be done. At that time, the major drivers of maternal mortality were hypertension, hemorrhage, and infection. Now the major drivers are well after delivery, and they fall into the realm of cardiovascular disease, suicide, drug overdose. So this expansion of postpartum coverage to the first year after delivery was really work that was established in our committee. We did the research on that, and we provided the guidance that now has been taken up by a great many states. So I look forward to a day where we can look at these numbers to be significantly reduced even over where they are now. because of the changes that we have made as a result of this legislation. It's important work. I want to encourage all of my colleagues to vote yes on the underlying bill, and I will yield back the balance of my time.